Today we're going to go over your strategy for how to avoid your knee replacement surgery. Now, I work with a lot of clients who have been diagnosed with conditions such as degenerative changes, bone on bone, worn meniscus, worn cartilage. And there are a few underlying components with all of those situations. And one of the big components is that of course, there's tension in the knee joint and it's causing pain. And there is nerves in your knee that are being interfered with because of that tension. So the first and foremost key to getting over or avoiding your knee replacement surgery is getting the pressure off of those nerves. Well, the first thing you would want to do with any therapy you would work with is to begin to create comfort within the joint. Think about it. If you started creating comfort in your knee and your knee did not hurt as much, there is a better chance that it's going to be able to heal. Now, when you create comfort, that is actually creating space in the joint. And that is a component. However, what we also want to do at the same time is look at the conditions. We want to create the conditions so it's setting up your knees so they'll heal on their own. The next piece is looking at water and nutrition. And getting the right amount of water is important to get into the joint with any of those diagnoses that you had. Arthritis especially, because arthritis, 9 times out of 10, the diagnosis for that includes a dehydrated joint. So by increasing your water intake, it's going to get water in your joint and it's going to help lubricate that joint, which takes the pressure off of the nerves. It all plays together. Same thing with your food. You want to eat proper food that is going to heal the damaged cells, the damaged tissue in your knees. You also want to look at stretching, because stretching, if you have tight muscles and those muscles are pulling close together, of course, if you have tension, that's what's going to happen. By stretching, you elongate the muscles and you help to create more space in the joint. The next piece that's very important that I don't hardly hear anyone talking about in the knee pain community is breathing. Now you can control the tension in your nervous system by breathing more. The more you breathe, the more you can control the tension, the pain that you're experiencing in your body. When your body relaxes, it's more comfortable, you create more space, and your body has more of an opportunity to heal itself. Now the last piece, and I'm going to put this last, and I believe it's very important, is exercise. Because when you have a situation where it's bone on bone, you have arthritis, you have degenerative changes, you have pain in your knee on a consistent basis, one of the last things you want to do is exercise. Because what happens is when you exercise and you already have nerves in your knee that are irritated, and you do the exercise in a way that's creating more tension in your knee joint, you're actually causing more problems than you're actually solving. So when I work with clients, exercise is one of the last things I do because I want to create comfort first. We want to create the space in that joint first. Then we want to create the conditions through water and nutrition that allows the body the conditions to heal itself. Then we look at breathing and stretching. Breathing and stretching also helps with the pain. And then the last piece, once you have that space in the joint, then you want to do the exercises. And the exercises are specifically for strengthening, not the muscles in the legs, but the tendons and ligaments in the knee joint itself. That's what provides stability and support to that knee joint. That's what's going to help you avoid your knee replacement surgery. Any type of therapy or treatment that you approach should be looking at it holistically, should be looking at it comprehensively. Because if you leave any one of those components out, you're leaving a ton on the table. And it also leaves you open for your knee to still be in pain. And when it's in pain, that means it's wearing. That means it's getting worse. So, if this information sounds good to you, then you're going to definitely want to check out my website. Go to thekneepainguru.com, and when you get to that website, I have a video that'll show you how to begin creating the space in your knee joint. At the same time, I also have a free report that covers these 5 key components that I'm talking about: the water, the nutrition, the exercise, the stretching, and the breathing. So, go ahead and check out my website. Fill in your first name and email address, get that free report, do that exercise, and start taking the steps that's going to get you to a place where you're not going to need that knee replacement surgery down the road. Thanks a lot. I appreciate you watching the video, and have a wonderful day.